Good afternoon, and welcome to today's webinar, Personal Care Product Use Among Women of Diverse Communities, the Taking Stock Study. My name is Michelle Dixon, and I am the Program and Development Director from Massachusetts Breast Cancer Coalition, and I would like to thank you for joining us today. I'm very pleased to welcome back today's speaker, Dr. Robin Dodson. Dr. Dodson is a research scientist at Silent Spring Institute with expertise in exposure assessment, particularly in the indoor environment. Research focuses on three main areas: development of novel exposure measurements for epidemiological and community-based studies, analysis of environmental exposure data with a particular emphasis on semi-volatile organic compounds, and intervention studies aimed at reducing chemical exposures. In addition to her position at Silent Spring, Dr. Dodson is an adjunct assistant professor at Boston University School of Public Health and a visiting scientist at Harvard T.H. Chan School of Public Health, where she completed her graduate training. Dr. Dodson, welcome.
Thank you. I'm very excited to be here. And I'm very excited to be sharing some of our research on personal care product use among women of diverse communities. This is a research area that we've been in for many years now, and I have some exciting results to share from a project that we're very actively involved in right now. So I guess first let's get started and talk a little bit about why we are even concerned about exposures from personal care products. We know from national biomonitoring data, so CDC does a national biomonitoring program, and we know from that data that that Americans are widely exposed to consumer product chemicals, and that those exposures are unequal, meaning that women of color are disproportionately exposed to many of these consumer product chemicals. And unfortunately, many of these chemicals are associated with hormone disruption, or what we call endocrine active. And that means that exposure has been associated in research with various health conditions, including increased uterine fibroids, preterm birth, diabetes, asthma, immunosuppression, and even breast cancer. And we know that many women of color are also disproportionately burdened by many of these health conditions. Now, consumer products are important sources of exposure to these chemicals, as you can imagine. And the reason that we may see some disparities in the actual exposure measurements in the biomonitoring data is because of disparate use of consumer products themselves. This is actually a table that I pulled from a great commentary that my colleagues Ami Zoda and Bhavna Shamasunder had published a couple years ago now in a piece that they called The Environmental Injustice of Beauty. And it was trying to highlight, it actually used three different kind of case studies or vignettes to talk about how women, particularly women of color, may be disproportionately exposed to some of these hormone-related chemicals because of certain or unique products that they might use. The first is that they discuss is this idea of colorism, these external society factors that may drive increased use of skin lightening creams, for example, and increased exposures to things like mercury. Hair texture preferences is also a reason, a social reason why many African American women or Black women may be using hair relaxers and other hair care products in an attempt to straighten hair to meet certain Eurocentric beauty standards, thus increasing their potential exposure to parabens or other estrogenic chemicals. And also, they highlighted issues around odor discrimination, again affecting mostly Black women. And this is actually particularly it's vaginal odor discrimination. And research has shown increased use among vaginal douches and other feminine care products among Black women. All of this kind of sets us up for this idea that it may be patterns in the product use that may actually be responsible for differences in the exposure to these chemicals that we see in the national biomonitoring data. A couple of years ago, Silent Spring published a paper that looked at endocrine disrupting chemicals in hair products that are commonly used by Black women. This study, lead authored by Jessica Helm at Silent Spring, we summarized the over 60 different endocrine disrupting chemicals in hair products that we had surveyed and knew that women, particularly this was what Black women living in New York City, were widely using, and finding that many of these common products contain endocrine disrupting chemicals. So we know that we can see the inequities in exposure from the national biomonitoring data. We know that some of these products that may be used almost uniquely by certain populations might have higher levels of endocrine disrupting chemicals. So the pieces of the puzzle are starting to come together. But we need to tie it together with whether or not product use could actually increase the biomonitoring data. So this is actually data from a recent study of ours at Silent Spring, from our crowdsourced biomonitoring study. It is when we had participants who basically enrolled themselves into a study and mailed us urine samples that were analyzed for consumer product chemicals. What I'm showing here is quartile of product use. So that's, more products that you use are further to the right. And then the concentrations of parabens. Again, parabens, which I actually shown on the first slide, parabens are preservatives that are commonly used in personal care products. And what I want to show here is that you can see that with increased product use, so that's moving across to the right, you can see increased concentrations in parabens in women. Actually, this is all adults mostly. And I want to distinguish the two different lines here. So we looked, what was interesting about the study is that we looked at both people who stated that they tried to avoid certain chemicals in their products. So we call them avoiders. It means they scrutinize their product ingredient labels when they were purchasing products. They were looking to see if they could find products, for example, that might not contain parabens. That is the purple line. The orange line are people who didn't necessarily take steps to avoid these chemicals. And while we can see that there is an increase overall for both groups, that increase is higher among those who did not necessarily read the product ingredient label. What's important here is that this is kind of a first step in that with some education, or when people can scrutinize or read their product ingredients, they can in fact actually lower their exposure to some chemicals. And that's really important if you're going to design an intervention study. But you'll note that still, even among the avoiders, there were still some increases in chemical exposure. That means that that the burden of trying to reduce your exposure cannot solely rest on the consumer. Rather, we also need some upstream policy or regulations that can help us avoid putting these chemicals into these products in the first place. So now hopefully I've tied together the idea is that we see inequities in the exposure. We believe that's related to product use because we know that product use can affect exposures. So I'm going to be talking about some results that we are collecting as part of our Taking Stock study. This Taking Stock study is a California-based study that is community-driven, and it's guided by the overall hypothesis that consumer product use patterns contribute to exposure and health inequities observed in women of color. This study was started about a year and a half ago with my colleagues. You can see them here. They include women from Black Women for Wellness, which is our community partner in the LA area. It's also led by Bob Nishamasunder of Occidental College. And this is a wonderful project in which we have kind of pulled together and are really trying to meet concerns that have been identified by community members, particularly women of color living in South LA, and more specifically, Black women and Latinas living in South LA. So this community-driven study has three overall aims. The first is to look at patterns in personal care product use among different women, among women of different racial and ethnic categories in California. The second is to characterize perceptions, accessibility, and use of personal care products among Black women and Latinas living in South LA. And the third is to do some product testing, to actually test some of the most commonly used or popular products that the women are using. Today, I'm going to be sharing data from the first aim of that study, which is a California-wide survey of product use. More specifically, I'm going to be sharing data from survey respondents of 18 to 34-year-olds. We did actually survey adult women 18 to 54 and have nearly 600 surveys from that group. What I'm showing you here is just a subset of that because we know that potentially that age might have a role in product use patterns. And so we wanted to help kind of minimize the influence of age so that we could specifically focus on the influence of racial and ethnic categories. Now, more specifically, I want to highlight that we are going to focus on women that categorize solely as Black, Latina, Asian, and white. We did have many respondents that considered either classified themselves as some other or as multiracial. And in this analysis, I'm not going to share that necessarily today, but we did actually, we have some of the first data on some multiracial women, which we're just starting to really dig into. But today I'm going to be focusing on these 4 broader kind of race ethnicity categories. But first, let's step back and learn a little bit more about kind of the group of women in general. So this is 360 women, and these and 360 total women. If we take out those identified as multiracial, we actually have 289 women. Of these women, they reported an average of using at least 8 personal care products per day. And in fact, some women you can see over on the right, kind of the tail, is that some women, in fact, one woman used up to 30 personal care products every day. Now, these are just the products that we asked about. We did not kind of openly solicit what products are you using. So the number actually is probably likely much higher for these women. We can break this down by those racial and ethnic categories that I had kind of highlighted before. And we can see there are some differences here, although not any statistically significant differences. But you can see that there are, I want to highlight too, is kind of the variability here, that there are women over on the right in each of these kind of distributions here that use a lot of products. And that is something that we want to kind of dig into a little bit more, the overall kind of cumulative burden of product use among some women. So we not only asked what products you used on a daily basis, but we actually wanted to expand that to think about products that you kind of use regularly. And what I mean by that is that there are some products that you might use every day, toothpaste, maybe some cosmetics, maybe some lotions. But there's other products that you might use less frequently that we are still very interested in learning about. Things like feminine care products, they might be related to your menstrual cycle, or even hair products. Depending on the type of hair product, you may use that less frequently. It's not a daily product necessarily. So now I'm going to be talking about data that we collected where we asked women, what are the products that you're currently using or have used regularly in the past year? So these are kind of the products that are like readily accessible in your, say, in your bathroom, that you consider kind of one of your kind of go-to products. So we're not necessarily talking about daily product use here. So here's a summary, again, putting all of the women together. We can see that women reported using a median of 8 cosmetic products. These are, again, these currently used products. Of the 13 cosmetics that we asked about, they used on median or on average 2 feminine care products out of the 12 that we asked about. 4 hair products, 5 leave-on personal care products, and 6 rinse-off personal care products. I'll get into what the differences are of those in just a moment. So again, these are currently or within the past year, kind of what you're regularly using. What I want to highlight here again is these are box plots that are trying to show the range of potential responses here. So again, well, on median, you could say that that women are using, say, 2 feminine care products. You can see that for some women, that number is much higher. It's more like 7, products, feminine care products that they use regularly. Again, noting the kind of the range that we see in the responses here and the number of products used. Now, these plots are meant to help us look at the differences in product use by race and ethnicity. So again, I'm only including data for women who solely identify as Asian, solely identify as Black, Latina, or white. And these are the different product groups. So we have cosmetics on the upper left, and that number there next to it is the number of cosmetic products that we asked about. And how you would read these is basically the line, the gray line in the middle there is the 50th percentile. So that's the median. So if you want to compare, say, on the cosmetic graph on the upper left, you can see that Black and white women, the red and the orange lines, are to the left of the Asian and Hispanic Latinx lines, which means that Asian and Hispanic or Latinx women are using more cosmetics at the median than Black and white women. In fact, they were using significantly more products in some cases. Moving across to the right, we can see feminine care, that generally white, Asian, and Latinx women reported less using less feminine care products than Black women. Among the hair products, that Black women reported significantly more hair product use than other women, followed by Latinx women, and then Asian and white. Among the leave-on products, you can see that the product use is similar for Black, Latinx, and white women, and Asian women reported slightly fewer. And among those rinse-off products, overall, white women reported fewer use of those products than Asian and Black women, and significantly fewer than Latinx women. Now I'd like to look at the products more specifically that comprise each of those groups. So here's cosmetics. So these are makeup, basically, and you can see them, the different ones that we asked about. So we asked about, for example, do you use concealer regularly, or you currently use it, or you use it regularly in the past year? And again, showing it for the different race and ethnicities. Overall, the most common cosmetics that were used among these women were mascara, nail polish, and lipstick. The least commonly used was setting spray, and it was used by only 37% of women. The orange squares are meant to highlight those where we saw significant differences by race ethnicity. So for powder, rouge, and blush, we saw Hispanic women using significantly more of those products than Black women. Similarly, for lipstick, in which the Latinx women were using more than Black and white women, and makeup primer, Asian and Latinx women more than Black and white women, although those were not necessarily significant in pairwise comparisons. So these graphs are meant to kind of give you an overall impression of the products that women are using, but also then try to highlight some of the differences that we're seeing by race and ethnicity. So let's move on to feminine care products. We asked about menstrual-related products, so things like the menstrual cup, sanitary pads, and tampons, but we also asked about some other products, washes, douches, powders, things like that. Overall, shaving cream is the most common non-menstrual product. Menstrual cup is not actually used by that many women overall, but it was used significantly more by white women compared to Black and Asian women. Similarly, white women are using more tampons than Latinx women. The vaginal and personal lubricants was more common amongst white women compared to Latinx women. Black women reported greater use of douche, although that was not necessarily statistically significant more than other women. That's been corroborated with some other studies. We also see that vaginal wipes, towelettes, and vaginal washes and cleansers are more common among Black women than white women. And in fact, the vaginal washes were the most frequently used product beyond the menstrual products, with 55% of overall users using them at least 1 to 3 times a month. So moving on to hair products. So I do want to preface this by saying that we were specifically asking about hair products that we know based on our previous research that Black women might more commonly use. So we are kind of at the outset, I would say, we would expect probably that that Black women might use some of these products more often, based on our previous research. And in fact, we can see a lot of differences. There are a lot of orange boxes here. So there's a lot of differences by race, ethnicity on the hair product use. Black women overall use many more products. Hispanic or Latinx women are the second most common user of hair products. Hair oil is more common among Black women, as is hair styling gel, edge control gel. Hair perms, relaxers, and chemical straighteners are used most commonly by both Asian and Black women, more so than among Latinx and white women. And it looks that Latinx women are more commonly using hair dye more than other women, although that's not necessarily significant. So now moving on to leave-on personal care products. Now we distinguish differences between leave-on personal care products and what we call rinse-off personal care products, mostly because from the exposure potential. I'm an exposure scientist, so I try to think of this as more as like, what is the potential of that chemical making it into your body? Now, if you have personal care products that you leave on your skin all day, there's a much greater potential exposure to that chemicals in those products than those products that you might rinse off with a use, say toothpaste, although that's used rather intimately in your mouth, but shampoos or something like that you might rinse off your body after its use. So the most common leave-on personal care products are deodorant, antiperspirant, hand lotion or body lotions, and creams. Also, perfume was fairly common. Nearly 33% of women reported using perfume at least 6 times a week. Sunscreen was also fairly common. Sunscreen use, in fact, was highest among white and Asian women, followed by Latinx women, and lowest among Black women. And that does include face creams with sunscreen too. That's not just full body sunscreens. Deodorant use was less common among Asian women than other women. Perfume was more common among Black women compared to white women, as was body oil. So now moving on to those rinse-off products, these are things like soaps. The most common, toothpaste, not surprising, hand soap, and body soap and shower gel. Now, I should have mentioned this before, all of these data were collected pre-COVID. They were collected from January 2019 until March 2020. And so this is all these, for example, these soap numbers reflect pre-COVID numbers. That may change. And it's something we're very interested in, looking at product use changes during COVID times. So these are pre-COVID. And from these numbers, we can see, that these products are very common. And then if we look at differences across race ethnicities, we see that mouthwash is used by more Black women and Latinx compared to Asian and white women, and that makeup remover is consistent with the makeup use in that Latinx is more commonly used makeup remover than Black women. So in addition to asking about which product types women are frequently using, we also wanted to learn a little bit more about some of the reasons why women choose these products. Now, the data on product use is very important if we are going to start trying to identify interventions to help women limit their exposures, right? We would focus on commonly used products, those products with the potentially highest exposure potential. And of course, those products that typically have ingredients that we are most concerned about. So that data is particularly important when we're trying to develop some intervention studies. but also very necessary when identifying intervention strategies for limiting exposure, is trying to understand a bit more about why women are choosing the products and where they go to learn more about the products that they're using. So this is actually, we surveyed the women about what are some of the factors that you use to decide, to help you decide which products you use. And they could choose all the different characteristics that they typically consider. So things like brand, effectiveness, ingredients, and so forth. And we can see from here that price and effectiveness are the top reasons why women are selecting products. And scent is important, particularly amongst personal care, when selecting personal care and hair products. We also see that brand loyalty is important, but it's less important than perhaps some of these other characteristics about the products. There were fairly few differences when we look at this across race, ethnicity. We did see that Black women characterize or less often selected effectiveness and price, and that for hair products, more often considered ingredients, brand, and longevity than other women, and particularly significantly more than white women. And the importance of this is in terms of developing intervention strategies, is that we know that women are sensitive to price. So if we can find alternative products without these chemicals of concern that are equally priced and equally effective, then those might be very good alternatives for those women. And the good news too is that women don't seem to be that brand loyal, meaning that we could possibly switch out products without women kind of like, oh, I've used that product for years, I must use that, brand X product. We also asked where women go to learn more or where they go to get recommendations. So, you go to your friends, do you go to your family, do you search on the internet to learn more? Excuse me. And you can see from this that friends are an important source of information, with over 50% of participants choosing friends as an important source for all the products except for feminine care. Family is most important for feminine care products. Probably not surprising, right? Like we learn a lot from our mothers or our aunties or whoever in our family about use of feminine care products. Although internet search and friends is important for feminine care products as well. Social media is used more often than other advertisements across all product types. And there are a few differences by race. For example, Asian women relied more on friends for personal care product recommendations than other women, and Black women relied less often on internet searches for cosmetics and more on family and less on advertisements for hair products. Now, so what does this all mean for an intervention project? This would suggest that how basically I think you would go about supporting supporting an intervention. This would suggest that if you can create kind of communities or peer-to-peer networks, family members, friends could support one another in doing an intervention study. And it's less so than kind of just blasting people with, say, advertisements in magazines or something like that in terms of how to help women choose safer products. So I summarize that first phase, that first aim of our taking stock study. We've pulled this together in a paper that's under peer review right now. And I want to quickly just bring up the next phase of the study that we have just started. We're very excited about it. It's hard to do, though, in the middle of COVID. But we've started what we call our community science phase of the study. In this phase, we are recruiting a total of 70 women living in South LA, and we are asking them to log their product use over an entire week. So to do this, Silent Spring actually developed an app. It's called the Taking Stock app, and it is a research app that the participants are downloading onto their phones. They create an inventory of all the products that they regularly use, and every time they use a product, they click it and log the use. And we get that data from over an entire week. We also collect information using surveys to learn a little bit more about those less frequently used products. And at the end of the week, we are collecting urine samples from these women so that we can look for associations between the specific products that they might use and their urine samples. And where this is an innovation over current projects is that we are collecting specific information about those products. So rather than just asking, do you use a deodorant or an antiperspirant? We are asking which deodorant and antiperspirant do you use? And more specifically, this app allows us for participants to take pictures of their products with the front and the back ingredient list. And that's going to be really important because then you can say, we see an association not only between, say, body lotion use and paraben concentrations, but we can say we see even stronger relationship when the body lotion has parabens on the ingredient label. Again, putting us kind of a step forward towards a more effective intervention approach or strategies that we could develop to help women limit their exposure to these chemicals. So if you would like to learn more about the project, I suggest you visit our website. I also want to highlight again, this is certainly a team project that is led by Bob Neshama-Sunder and Jan Robinson Flint, and has many, obviously, community members and other researchers that make this happen. The main funding for this project is the California Breast Cancer Research Program, as well as the Passport Foundation. And we are just kind of right in the middle of this project. So I'm really excited to hopefully share some of the results from the next phases of this project with you all on an MBCC webinar in the future. Now, before I finish, I want to do another plug for another project that I'm also working on. So this is actually a new study that we are just launching here in Massachusetts called the POWER Study. The POWER Study is Product Options in Women Engaged Research Study. And we are wanting to collaborate with Black women living in Massachusetts to learn more about their personal care products. This is a collaborative project with the Resilient Sisterhood Project, and we are just recruiting women now. We are asking women to take part in 2 workshops. The first will be virtual workshops, not in person, but virtual workshops. The first workshop, we will learn a little bit more about why women are choosing the products they're using. We will then ask enrolled women to scan and log their product use over 3 days using our app. And then we'll have a follow-up workshop where we will share study-specific tips on limiting exposure and have a broader discussion about chemicals and products at that workshop, likely to be held probably in May. So if you are interested in this study, I suggest that you check out our website there, tinyurl.com/more on power to learn more. You can sign up for an interest form there. Again, we are recruiting women right now and would love to hear from you. So if you want to learn anything more about our personal care product research or any of our other research at Silent Spring, I encourage you to go to our website at silentspring.org. You can learn about our science. You can learn about kind of our impact. You can learn about what drives us to do the research that we do. And of course, I've added my email address at the bottom there. I also, particularly for this group, since I've been talking a lot about personal care product use and their effect on exposure, I want to draw your attention to a free smartphone app that Silent Spring has developed. This is free on iPhones. It's also free on Android phones. And this app, Detox Me, compiles over 200 research-based recommendations for reducing your exposure to everyday chemicals, including many of the chemicals that I've talked about today, or chemicals that you might find in everyday products. So I encourage you to check it out. It's a fun app. You can move around, kind of earn as many badges as you want. And of course, that's all backed up by the research that we've been doing over the last 25 years or so. So with that, I want to say thank you, and I'm happy to take any questions.
Great. Thank you so much, Robin. And we do have some questions for you. One actually isn't related to the fact that you're doing a second study in Massachusetts. And the question is, do you expect to see any geographic differences that could play a role in terms of product usage and maybe the way women, particularly women of color, are approaching product use, personal product use?
I think that's an excellent question, and it's a question that we have. We don't know yet. I think, in talking to women, I think there are geographic differences in product use, but I am not aware of a study that has really tried to look at those differences. So this power study it's funded by Turry here in Massachusetts, and the purpose of that project is really to try to develop some of the preliminary data so that we can do a much broader study, say a national study where we would look at product use patterns across the U.S., particularly among women of color, to see if there are different patterns geographically, because I think that would be very interesting to look into further.
And I've got another question about, will there be a component of this project that looks at the companies themselves and the ingredients that they're using?
Yes, so that is an interest of our community partner, particularly Black Women for Wellness in Los Angeles. We will not be evaluating companies per se in this project, but I do think we will be providing some data that could be used by community organizations that do want to engage with companies to learn more, also to help them evaluate companies or brands that they might want to kind of put under a microscope, kind of thing. And so the short answer is no, we are not, that's not part of this project, but I think we are developing, or kind of gathering rather, data that could be used to do that type of study.
Okay. And what about the age range of the women that you're looking at? And in particular, will there be, or is there a focus on younger women?
That's a good question. I still think there's a lot to be learned broadly about some of these product use patterns, but I think that's a really interesting question, to think about the role of age here. I suspect there are very much differences in some of these product uses by age. I mentioned on one of the slides that we will be doing some focus groups where we're going to be talking more, kind of having just an open discussion with women about their product use choices. And we are going to specifically recruit teenagers, a focus group for teenagers, because I think teens might be using products slightly differently, or have kind of a different approach to choosing their products. I also think there's probably differences in postmenopausal women, or much more older women, on the products that they might be using, depending on where you are in your life professionally and things like that. So I think age is a fascinating way to look at this. It's something, as we think forward in doing more work in this area, particularly the Taking Stock project, kind of next steps. One of those next steps is that we would like to look on the outside, less than 18 and more and older than 55. And so to try to see if there are differences there. Some of our data do suggest there would be some differences, and maybe it's not surprising. For example, even in like menstrual care, we know that in the data, kind of a preliminary look, we could see differences in menstrual products that women were using. Menstrual cup, for example, pretty much only used by the much younger set, the 18 to 24-year-olds, compared to other women where tampon use was used by more kind of 20s and 30-year-old women, and pads used by older women. So we know there are differences there, and it likely is dependent on the product itself, but it's something we want to learn more about.
Great, thank you. And to address this next question, can you speak to looking at the combination of products? And is there a potential correlation in terms of, I know you were looking at the number of personal care products, but the question really is speaking to any correlation between particular personal care products.
Yes, so we have looked at that. That is not something I highlighted here. That's hard to show on a slide. but
Sure.
in our paper we highlight it. But yeah, so we looked at correlations among different products in two different ways, actually, with concurrent use of products. The first is we just looked at the correlation between, say, use of shampoo and conditioner. And you can imagine that's very high. The correlation between mascara and lipstick is also very high. But it's also interesting to look across things. Women who use certain hair products were more likely to use some cosmetics. So that's interesting to dive into. So yes, we have been looking at co-exposures. The other way that we're looking at co-exposures is that we have compared kind of the top 10% of users. So the top 10% of women who are using the most products, just based on number of products that they're using, and then the bottom 10%. And we can see clear patterns there, right? So we have what's common among those two groups are what we kind of call these essential products. So things more like hygiene products, so toothpaste, soaps, things like that. And where you start seeing the difference between a woman who uses a lot of products and uses less products is kind of the introduction of cosmetics. It's kind of almost like once women start using cosmetics, they really start using cosmetics. Most women are not likely using just mascara, for example. They might be using a whole suite of cosmetics regularly. And so we can see that with our data. Also, what's kind of interesting is what's consistent across and kind of makes you feel better is that there's some of the other kind of things like deodorant or sunscreen or something that doesn't seem to be driven by are you a heavy product user or not. It's kind of fairly consistent across the lower and higher product users. So I think what the question is kind of hitting on a really important point, which is the kind of the cumulative burden or potential cumulative exposure to some of these chemicals and products, that we do not use one product in isolation. We are not solely exposed to those chemicals using that one product, but rather we use many products on a daily basis or regularly. And many of those products do contain chemicals that we are concerned about. And that is something that we are going to further kind of tease apart. What are some of those kind of common co-use patterns that we're seeing?
Great, thank you. I'm going to take a moment just to see if we have any more questions. Well, Dr. Dodson, I want to thank you for this presentation today, and I am going to take you up on your offer. I hope you will come back and share future findings with us as this study moves forward. On behalf of Cheryl Osimo, MBCC's Executive Director, and our Board of Directors, I want to thank you for joining us today, and I want to thank all of our listeners for participating. For those who are interested in the recording of this webinar, it will be made available later today. It will be posted on the MBCC YouTube channel, as MBCC's website is going through a redesign, but we will make sure that it is available. And if you would like to access a copy, you can also reach out to me directly at mbcc.michelle@gmail.com, and I will make sure that you receive a recording. Dr. Dodson, again, thank you so much, and I wish everyone a good afternoon.
Thank you.